Welcome to the first episode of our second part talking about the daily practice of endodontics. When we start our treatment by controlling the pain, which means that giving anesthesia. So, anesthesia affects the nerve fibers by blocking the sodium channels by the molecules of the anesthetic solution, which are the Rn and the RNH plus, are molecules that form when the pH of the medium is acidic. So the Rn molecules crosses the cell membrane, blocking the action potential of and allowing the sodium to enter. So they are responsible for the mechanism of the anesthesia. We have something called these channels are voltage gated sodium channels, and there are other molecules that are produced from the prostaglandin. The prostaglandin initiate the production of these material like the TTXR. These material permits and opens the gates of the sodium channels, which means that it gives it permits more ions to get inside and make the pain signaling more efficient, and lowering the threshold of activation, which means like the fibers become more sensitive to pain, and this is the reason why when we have irreversible pulpitis, the nerve fibers become, or the pulp become more sensitive to electric pulp testing. The most common local anesthetic is the 2% lidocaine, which has an epinephrine, and its maximum allowable dose is 13 ampule, and the typical maximum is 8 ampule. What affects the efficiency of the local anesthesia is the pH of the medium, which we said previously that acidic medium decreases the efficiency of the anesthesia. Also, the inflammation that alters the threshold of the pain and lower it, and increases the excitability of the nerve, which causes the pain. Now talking what actually a theory that is called the center core theory explains why the efficiency of the anesthesia differs from the anterior teeth and the posterior when doing the nerve block, the inferior nerve block, is because the bundle that nourishes these teeth has two parts: the core bundle that nourishes the anterior teeth, and the mantle bundle that is responsible for the posterior teeth. So the anesthesia, when we give the block, infiltrates from the mantle to the core, which means that the amount of anesthesia that is reaching the core is less than the mantle bundle, and this explains that why the anterior teeth do not become anesthetic when we give the inferior alveolar nerve block. If you want to increase the time of the anesthesia, we can give an additional ampule before the first ampule loses its efficiency, which means we can give an additional ampule after 30 to 45 minutes of the initial one. In this way, we can increase the time of the anesthetic procedure. When we do an inferior nerve block and the patient has the soft tissue signs like numbness of the lip or the tongue, but when we start doing the procedure, the pulp is still hurting, so we do not give an additional ampule for a block ampule. Now we give what is called a supplemental anesthesia, that is infiltration injection in the buccal or the lingual, or an intrapulpal inside the pulp directly, and we must feel the pressure of the solution that is penetrating the pulp. This intrapulpal injection lasts for 15 to 20. Maxillary anesthesia is mostly done with infiltration, and its success rate is between 87% to 92%. Now, we talked about anesthesia as a way to control the pain. Now let's talk about non-inflammatory, non-steroidal analgesics, which means that the first analgesic that we use in dentistry is ibuprofen. It is always prospected unless there is a contradiction like pregnancy and arthritis. Also, if the patient is taking aspirin, it can cause internal stomach bleeding. Other than this, it's the first and more efficient non-steroidal anti-inflammatory. To relieve the pain, we have also the aspirin in high dosage can decreases the pain. The diclofenac and the ketoprofen are also options. Mechanism of anesthesia. Anesthesia affects nerve fibers by releasing molecules that block the sodium channel and stop the nerve signal from reaching the nervous system. Two types of two types of molecules are presented in the anesthesia solution. The first is the uncharged basic form of the molecule, which is the Rn. This Rn crosses the cell membrane and causes the effect of anesthesia. The other one is the charged acid molecule, which is the RNH+, that forms in acidic solution, which is the pH when it is decreased, so it forms more when the inflammation is present. Thus, it decreases the anesthetic effect. So the more we have of the Rn molecule, the more anesthesia that we will get. The maximum lidocaine dosage is between 8 to 13 ampoules. We can increase time of anesthetic effect by giving additional ampoule before the first loses its effectivity, which means after 30 to 40 minutes of first ampoule. Ibuprofen is another type of controlling the pain, which is a non-steroidal anti-inflammatory drug. Is generally considered the prototype of these kinds of drugs, and it is the first medication to be used to control pain unless there is a contradiction for this, like pregnancy, arthritis, and aspirin intake, which the patient may have a danger of internal bleeding.